My name is Kieran Longley. I'm a consultant gastroenterologist in the Blacktown and Mount Druitt public hospitals in New South Wales. I also have consulting rooms in Campbelltown, Blacktown, and I've just recently opened up in Richmond in the Hawkesbury region. I grew up in Tasmania and I completed medical school through the Northwest Regional Hospital in rural Tasmania. After completing medical school, I wanted to move to a metropolitan hospital, so I moved to Sydney and started work in the Liverpool Hospital, which is one of the largest hospitals in Australia. From there, I had a lot of exposure to inpatient medicine, and that has become one of my passions throughout my career. Through my basic training, I worked in the St Vincent's Hospital Sydney network through St Vincent's, Campbelltown and Wagga Wagga Base Hospital, and made some really good connections with the gastroenterology unit at Campbelltown. I started my advanced training in gastroenterology at Campbelltown and found that I had a real knack for endoscopy. And Campbelltown Hospital is a really fantastic unit for learning the fundamentals of endoscopy, and they really pushed my career forward in that aspect. I've then gone on to do a fellowship in advanced endoscopy through the Blacktown Hospital and then continued on my work there after that. As part of my work at Blacktown, I've been able to expand some of my subspecialty focus, and I've also been working in hepatology and in inflammatory bowel disease through outpatient clinics through the Blacktown Hospital. I think the biggest project I've been working on recently has been creating an automated system for the Blacktown and Mount Druitt Public Hospital to really showcase the quality of our colonoscopy and to highlight some of the metrics that we've already been manually checking, and creating an automated dashboard to give real-time feedback on how the quality of the colonoscopy is going throughout the year. That was a multi-month project that I did in conjunction with the data analytics department in the Blacktown Hospital, and we've been able to provide real-time feedback on the quality of our colonoscopy through the Blacktown and Mount Druitt Hospital, and this is now starting to expand throughout our health district to the Auburn and Westmead hospitals. This was quite a large project, and I think that it has quite a lot of benefit, particularly for our community, in terms of monitoring and ensuring that our quality metrics are staying as up to date as possible. Whereas in the past, we've been more reliant on individual performance metrics and doing 3 yearly checkups with the recertification committee. Some other projects that have been a bit more interesting have been sort of more playing around with the newer technologies that are coming about. One interesting area that I've had a little bit of a toy around with is using Gaussian splattering to try and make 3D rendering models of colonoscopy, and that still is in a very early stage, but there could be some utility in terms of creating 3D models of what a colon looks like, potentially helping with the location of colorectal cancers and helping the surgeons when they're planning for their surgical resection in those particular cases. More recently in our private practice, we're introducing transient shear wave elastography, which is a special kind of ultrasound which lets us delineate patients with chronic liver disease, such as non-alcoholic fatty liver disease or viral hepatitis, and look at those who are at higher risk of developing cirrhosis. Because non-alcoholic fatty liver disease is a rising problem in our community, I think access to this kind of technology will be helpful in helping to try and prevent the development of cirrhosis in these patients and look at people who are at much higher risk of having poor outcomes from chronic liver disease. Having worked as a consultant gastroenterologist for 3 or 4 years and completing gastroenterology advanced training and fellowship over another 4 years, certainly the rise of obesity is a huge factor in our specialty, and this relates into multiple different areas. The most prime one is that of the incidence of non-alcoholic fatty liver disease, which is certainly rising throughout the world. Up to 5% of patients who develop non-alcoholic fatty liver disease can go on to develop cirrhosis, so it certainly can have a massive impact, particularly into the future. There's also the thought that the rising levels of obesity can link into other chronic medical conditions and increases people's risk of colorectal cancer. Certainly young onset colorectal cancer is a massive issue for us in gastroenterology, and is certainly a rising problem. The absolute incidence of young onset colorectal cancer is still lower than in the older population, but the trend on that rise is definitely a concerning trend. Certainly there are concerning projections for the risk of colorectal cancer in the Hawkesbury region, which does seem to be rising. And I think that timely intervention with colonoscopy and with national bowel cancer screening is a very effective tool to try and prevent colorectal cancer, and hopefully we can mitigate some of that risk going into the future. My career pathway was quite a winding pathway, and I think that for a lot of people coming into this career, having a passion for what you're wanting to do is really key. I knew from quite an early stage in my career that I was quite passionate about interventional procedures and being able to make an immediate difference for patients. And that career sort of pathway, it does open quite a lot of different doors. You have interventional procedures such as surgery, cardiology, gastroenterology, and I really found my passion through doing endoscopy through the Campbelltown Hospital. And I think that passion is something that you really do need in order to complete such a long career pathway in order to become a consultant gastroenterologist. The training that you need is quite long, and there are many years involved in terms of completing both your medical school and then your basic training, advanced training, and then finally setting up to become a gastroenterologist. I think it's important to find something that you're passionate for, and that may not necessarily be apparent at the start of your career trajectory. For myself, it was about 7 years of basic and advanced training, as well as an advanced endoscopy fellowship, before I found some stability in my career and was able to set up as a consulting gastroenterologist. Throughout that time, I had a lot of advantages through networking with some really great gastroenterologists who were really mentors for me. Ian Turner and Vincent Ho at Campbelltown Hospital come to mind as sort of big pushes for my career forward. And so I think having that opportunity to network with people and also to take advantage of the opportunities that arise is probably very important in terms of becoming a gastroenterologist or any subspecialty field that you're interested in. My biggest passion is endoscopy. I really enjoy particularly inpatient emergency endoscopy, being able to make an immediate difference for a patient. For example, I had a patient the other day who had massive bleeding from a lower GI source, and I was able to go in and really quite simply fix that bleeding and stabilize that patient, and that gives me a lot of immediate satisfaction. The technical work with endoscopy gives me a lot of satisfaction to be able to do this quite challenging procedures and do them in a technically satisfying way. And then sort of in the longer term, the kind of patients that I have in gastroenterology are also very satisfying. We have our patients who've got chronic liver disease under the sort of hepatology subspecialty, and these patients you stay with for many years. They often are challenging patients, often have their own medical challenges, which you need to help manage. And then we have sort of our younger cohort of patients in gastroenterology through the inflammatory bowel disease subspecialty. And these patients present their own sort of challenges, and often you're working with them for many, many years. And so it can be quite satisfying to see how their progress goes, to see how sick and unwell they are, and be able to make changes for them to really improve their quality of life beyond what they had before. Particularly since moving out to the Richmond area, I've been getting really involved with bushwalking. I've done quite a few treks up in the Blue Mountains recently, along Porter's Pass, which is a really great isolated track. And I'm planning actually to do a multi-day camping trip this weekend with some of the endoscopy nurses from Blacktown.